Hello, my friends. It's Dr. Sharon with Clinic Reviews. Today we're going to continue working through the Blue Book and we're going to be talking about migraine headaches. We're also going to focus on the treatments for migraine headaches and any education you may want to do for the medications that surround those migraine headaches. So let's go ahead and get started. Hello, my friends. It's Dr. Sharon with Clinic Reviews, the home of the very best Nclex review in the entire universe, in my opinion. You know that Mark Klimek is the GOAT of Nclex prep. You can go to climacreviews.com and sign up for our online, on-demand 21-plus hour Nclex review. You can also sign up for our streaming service. Our streaming service has all the videos that you ever found on YouTube related to Klimek that we made. Some of the ones that I've taken off of YouTube are on our streaming service, and then some additional videos that have never been on YouTube are on our streaming service. You can also sign up for our small group tutoring, and I do participate in the small group tutoring. I do the next gen tutoring sessions, so if you want to meet me live over Zoom, you can sign up for our small group tutoring. Let's go ahead and get started with migraines. So let me just tell you one thing about migraines. Migraines are a vasoconstriction followed by a rapid vasodilation. Okay, it's a vasoconstriction followed by a rapid vasodilation. That is essentially the pathophysiology of a migraine. So any medications that cause vasodilation can exacerbate headaches. So I'm not telling you that to give you a specific name of a drug. I'm just telling you this is why headaches are such a common side effect of so many drugs, because so many drugs have either mild or severe vasodilation or vasoconstriction effects. Okay, so that's just something to think about as we go through with it. Okay, select all characteristics consistent with migraine headaches: photophobia, phonophobia, pulsatile quality, duration, greater than 72 hours, aura, or occipital location only. All right, so it does talk in the Blue Book about symptoms of migraine headaches, so we'll just see if you remember that. So photophobia is light sensitivity, and that's definitely a quality of a migraine headache. Phonophobia is sound sensitivity, which is also a component of migraine headaches. Pulsatile quality, so there could be other names for that, but it's like a throbbing. Think of it as a throbbing. So pulsatile quality and throbbing mean the same thing. They do not tend to last greater than 72 hours. Cluster headaches, if you've ever heard of cluster headaches, tend to last longer than 72 hours, sometimes for weeks or months. Cluster headaches can last, but migraine headaches do not tend to last 24 hours. Yes, I would not say more than 72 hours. Aura, not everybody gets an aura. Okay, not everybody does. An aura is a sensation that you feel a little strange, may kind of change your perception of the world a little bit. It's not pain, but it's sort of this sensory change that you feel that sometimes comes right before or soon before migraine occurs, sometimes a day before, but often closer to the migraine than that. So people know when it's going to come, but not everybody gets an aura. So don't look at this and say, well, I don't get auras. Okay, fine, you don't get auras, but auras are a characteristic consistent with migraine headaches, even if you don't get them or your patient doesn't get them. So aura is true. Occipital location only, no. They really can be many different places for many different people. Sometimes it is localized. The migraine is localized. Sometimes it tends to encompass the whole head, but it's certainly not in one simple location. So A, B, C, and E are the correct answers. A client with known coronary artery disease arrives with migraine. Which medication should the nurse question? Sumatriptan, ibuprofen, prochlorperazine, or acetaminophen? So remember, migraines, the pathophysiology is constriction followed by rapid dilation. So the medications that we give that treat migraine causes vasoconstriction. So that's a big, big problem when someone has coronary artery disease. The most common medications that are used to treat migraine headaches are contraindicated in someone who has significant vascular disease, whether it's coronary artery disease or they're at risk for stroke or they have peripheral arterial disease. They're not going to want the person to take a medication that causes vasoconstriction. So which of these medications causes vasoconstriction? Well, the triptans are those medications that cause vasoconstriction. Ergotamine is another drug. It's a much older drug, but it also causes vasoconstriction. But whenever you cause vasoconstriction, y'all, you have other symptoms. Like sometimes they feel some transient peripheral neuropathy. Along with that, they also may experience nausea associated with that when they cause vasoconstriction. And sometimes they actually feel sort of like almost like a neuropathy in their head, like kind of a burning in their head that's similar to that feeling of neuropathy. So those are some different symptoms they could have along with it, but they're contraindicated in patients with coronary artery disease. Which points should be included when teaching about triptan therapy? May cause chest or throat tightness. Use no more than 2 doses in 24 hours. Safe to combine with MAO inhibitors. Administer at headache onset for best effect. Avoid within 24 hours of ergotamine use. Requires slow IV infusion. So if you know that triptans cause vasoconstriction, then even if you don't know much about them, you should be able to kind of reason through. So it can cause chest or throat tightness. That is a true statement. Use no more than 2 doses in 24 hours. Why would that be the case? Well, because if you're causing vasoconstriction, you don't want to cause too much vasoconstriction, okay? So 2 doses in 24 hours is considered the maximum dose for the triptan. Safe to combine with MAO inhibitors. So if you don't know the answer to this, then don't go, well, probably, okay? So if you're like, I've never heard of it teaching it's safe to use with MAO inhibitors, then I wouldn't teach it. So your best strategy when doing SATA questions is if it makes sense, then pick it. If it doesn't make sense or you've never heard of it before, don't pick it. MAO inhibitors, by the way, are antidepressants that can have some pretty significant consequences with blood pressure. And so it's actually not safe to use with MAO inhibitors. Administer at headache onset for best effect. Well, that would make sense. So any drug that you use at the beginning of onset would have the best effect. So that just makes sense just to pick that. Avoid within 24 hours of ergotamine. Remember I told you ergotamine is another drug that does the same thing. So do you want to give a vasoconstrictor within 24 hours of another vasoconstrictor? And the answer to that is no. Requires slow IV infusion. Well, people can take it at home, so it doesn't make sense that it would require slow IV infusion when they can take it at home. So they can actually take it orally or nasal spray. Those are 2 ways they can take it at home. Which preventive medication is most appropriate for a woman of childbearing age who experiences frequent migraines? Because a lot of the meds that they take normally are contraindicated with pregnancy. So valproic acid, propranolol, ergotamine, or naproxen. So ergotamine is contraindicated just like the triptans are contraindicated with pregnancy. Valproic acid is out, and naproxen is an NSAID, and NSAIDs are out with pregnancy. So propranolol is a beta blocker. So the idea with the beta blockers is that you can stabilize the vessel wall so it's not so prone to this constriction dilation. If you can stabilize the vessel wall by giving a beta blocker, you're going to prevent the headache. And beta blockers are safe to use with pregnancy. So that's considered an appropriate prevention for this type of headache. Select all potential complications of untreated or poorly managed migraine. Status migrainosis, medication overuse headache, trigeminal neuralgia, depression and anxiety, transient ischemic attack, or cervical spine instability. So potential complications of untreated or poorly managed migraines. So if you don't know the word status anything like status epilepticus or status migrainosis, even if you've never heard of the word status epilepticus or status migrainosis, you should know when it has status in front of it. It means something that won't stop. So status epilepticus is when they're having a seizure that won't stop. Status migrainosis is when they're having a migraine that won't go away. So it seems like if it's poorly treated or untreated or poorly managed, they could end up with a migraine that won't go away. That could definitely happen. Medication overuse, very common. So medication overuse headaches actually can occur. So people take medications that help the headaches, but then they overuse them and their body becomes sort of tolerant of the medication. It doesn't really do anything. Triptan's the same way. If you use a Triptan every day, eventually it's going to stop working. Okay, so medication overuse headache is definitely a problem. Trigeminal neuralgia. Trigeminal neuralgia is damage to cranial nerve 3, and migraines really don't have anything to do with cranial nerve 3. The tri tells you it's cranial nerve 3. So we're not going to pick that. Depression and anxiety, absolutely. That just makes sense. That's just a common sense answer. Remember, don't throw your common sense out the window. Transient ischemic attack. So could complications of untreated or poorly managed migraines cause a transient ischemic attack, which is stroke-like symptoms that eventually go away? Well, if you're particularly taking like vasoconstrictors and it's not well managed, you're not using them correctly and you're overusing them, you could definitely have transient ischemic attack symptoms. That's why we teach people how to use those triptans and the ergotamine correctly, because we don't want them to have a stroke or a heart attack. So that could definitely happen. Cervical spine instability doesn't have anything to do with the cervical spine. So doesn't even make sense really to pick that one. So A, B, D, and E are the correct answers. When teaching a migraine client about trigger avoidance, which trigger should the nurse emphasize the most? So there's tons of triggers for migraines. The question is, which one of these is a trigger? Loud noises, wearing eyeglasses, skipped meals, or low sodium diet? So the correct answer to that is skipped meals. There's a lot of food triggers. There's a question coming up related to specific foods that are triggers, so I'm not going to tell you that right this minute. But there are a lot of food triggers, including hunger. Skipping meals so we teach them you need to have regular scheduled meal times and then avoid the triggers. So you can tell them, here's triggers, and a lot of times they'll go, oh yeah, that's definitely a trigger for me. And they know it. They already know it because maybe they're already avoiding those foods. Other things that can be triggers are changes in barometric pressure. So we may say like sudden changes in the weather, because that's a change in barometric pressure. So that can also be a trigger. Hormonal changes can be a trigger. So these are all things that can trigger a migraine headache. Which foods are common migraine triggers? Aged cheeses, red wine, processed meats, fresh fruits, chocolate, or popcorn. Classic triggers for migraine headaches are aged cheeses. Cheddar is a big one. Red wine is also known to be a trigger. Processed meats. Now, specifically processed meats with nitrates, but generally we say processed meats because many of them have nitrates. That's how they're able to last as long as they do. And then fresh fruits are fine. Fresh fruits are not triggers. Chocolate is a classic trigger for migraine headaches, and then popcorn is not known to be a trigger. And interestingly enough, these are the same foods that they have to avoid when they're taking an MAO inhibitor. MAO inhibitor, monoamine oxidase inhibitor, is an antidepressant. And these are the exact same foods. So remember, the foods you have to avoid to prevent a migraine are the same foods you have to avoid when you're taking an MAOI. A client's headache described as a tight band around the head lasting days, but without nausea or photophobia is most consistent with which type? Migraine, cluster headache, hemicrania, continua, I don't know what that is, tension type headache. Well, it's not a migraine because migraines don't tend to last days. Cluster headaches do tend to last a long time, but they also tend to be localized, not a tight band around the head. And so tension type headache is actually the correct answer. Now, tension type headache doesn't have to last for days to be a tension type headache. It's the tight band around the head that is more classic of the tension type headache. It can last for days, but it doesn't have to. So that's not the reason that I'm picking tension type headache. Select all recommended lifestyle modifications for migraine prevention. Regular aerobic exercise, consistent sleep-wake times, high caffeine energy drinks daily, adequate hydration, skipping breakfast occasionally, stress management techniques. So what you want to do is to prevent vascular instability, right? Prevent vascular instability. So what are some things that can promote vascular stability? Well, regular aerobic exercise can promote vascular stability because it enhances parasympathetic tone. That's why someone's heart rate with regular aerobic exercise, their resting heart rate goes down, their resting blood pressure goes down, because they have enhanced parasympathetic tone. It stabilizes the vascular tone. And so that can also help prevent headaches. Consistent sleep-wake times. that just kind of programs the body to expect certain things at certain times, and so it's not as likely to cause vascular instability. So that's a good one. High caffeine energy drinks daily. Actually, that does not cause vascular stability. Now, if you have regular caffeine the same time, the same amount every single day, I guess that would be okay. But if you're taking in a lot of caffeine for a week and then all of a sudden you stop, that's going to cause vascular instability. Okay. Or if you you normally don't drink caffeine and then you do have a high caffeine drink, that's going to cause vascular instability. So caffeine is better to have a consistent amount of caffeine. Adequate hydration. Well, just like hydration is important for blood pressure management, vascular stability is important for hydration and vascular stability. So that would be true. Skipping breakfast occasionally, that's not good. You want to have routine meals, routine foods, so forth. Stress management. I mean, stress causes vascular constriction, right? Which is sort of one of the underlying pathophysiological processes. You have vasoconstriction followed by rapid vasodilation. So if you're stressed a lot and you have this vasoconstriction, then your body finally goes relax, then you have this headache. Have you ever noticed like you're really super tense? Like you're focused, you're super tense, and all of a sudden the stress goes away, whatever it was, and then you sit down and relax, and all of a sudden you get this pounding headache. That's that vascular instability. So the correct answers here are A, B, D, and F. A client recognizes an aura before headache onset. The nurse should teach the client to do which action? Lie down in a dark, quiet room and take abortive medication. That means abortive means something to prevent it from happening. Go out for a 30-minute brisk walk. Apply heat to the neck and shoulders. Skip breakfast. So I hope this is pretty obvious to you now. Lying down in a dark, quiet room and taking your abortive medication is the best thing out of these options. So I wouldn't do any of these, to be honest with you. So heat and neck, I would be more likely to apply a cool cloth rather than heat because you're already having, if you have an aura, you know what's coming is vasodilation. So if you apply heat, you're going to have faster vasodilation. That's going to make your headache worse. So I'm going for cool cloth, not heat. 30-minute brisk walk. Actually, you're going to have some vasoconstriction while you're walking, but then when you stop, you have enhanced parasympathetic tone, so then you vasodilate. Have you ever gotten a headache after really hard work? Like you've maybe gone out and chased the dog in heat or played with the dog outside in the heat. When you come back in, you get a headache when you relax. So sometimes that can happen. So it's not the activity that stabilizes the vascular muscles, it's the routine aerobic exercise that stabilizes the vascular muscles. So a one-time walk isn't going to help. And then obviously, skipping breakfast is not a good option. Patient teaching for acute migraine medication should include which points? Take it the first sign of headache, limit use to less than 10 days per month, combine Triptan and ergotamine for faster relief, avoid driving until effects are known, store medications in warm environment, expect chest tightness as a side effect. Okay, so we already know that patient teaching for acute migraine medication should include which points. So when it says acute migraine medications, that's talking about the meds you take to to treat the headache or abort the headache. If they're taking a medication every day, that's a prevention. And those are different types of medications. Those are actually usually blood pressure meds, like calcium channel blockers, beta blockers are used to prevent migraines because you can stabilize the vessels. And then there's also some neurological meds they can take. Anyway, if you're taking abortive medication, and abortive medication is for the acutely for the migraine, you want to take it the first sign of headache. That's good. And you don't want to use it too often because the body's going to start to become tolerant to it. And tolerance means they no longer respond to the medication. So limit use to less than 10 days per month. Plus, it can cause symptoms of stroke. Combine Triptan and ergotamine? Absolutely not. Don't do it because you could have really serious vasoconstriction. Avoid driving until effects are known. That's always a good recommendation. Any new medication, don't drive until you know how it's going to affect you. Store medication in a warm environment. That's not true. You want to store it in a cool, not cold, cool environment. Avoid direct light, sunlight, and so forth. That's usually how I tell people to keep their meds in a cool, closed environment. Expect chest tightness as a side effect. Y'all, they could have chest tightness, but that should not be a side effect. If they have chest tightness, they need to call the doctor okay, because they're going to stop the medication. It's an adverse effect. Chest tightness is an adverse effect. So we don't teach it as a side effect. Side effects are things that we go, you could have this, but we're going to manage it. Keep taking the med even if you have this. Like let's say a Triptan causes nausea, right? So I'm going to say you can still take the med even if it causes nausea. We just have to manage the nausea, as opposed to me saying, okay, if you take a Triptan, it could cause chest tightness, but that's okay if it causes chest tightness. We'll just manage that. No, if it causes chest tightness, we're going to have to stop the medication, okay? All righty. So I hope that was helpful to you for migraines. You can get migraines on the Nclex, so it's not complicated, but it's easy enough to learn, but you should know it. And I wish you all the best. Remember, be ready for 155 questions. You do not want to sabotage yourself. Okay, so you have to be ready. So say to yourself, if the computer switches to 86, flips to 86, I'm going to go, yes, I'm still passing, right? Because as long as you're still getting questions, you are still passing. Many people tell me they pass at 155. It happens all the time, okay? So you want to be prepared. If it goes to 155, celebrate. That's a good thing. You probably passed. You won't know, until the next day. But be confident, go in there, focus on the question in front of you, not the question you just answered. The question you just answered is done now. And even if you missed it, who cares? You're allowed to miss like a whole bunch of questions and still pass, okay? So if they're still asking you questions, you're still passing. So even if you missed the last question, it doesn't matter because you're still passing or it would have shut off, okay? So be confident, be ready for 155. I wish you all the best. Thanks for being a part of the Clinic Review family.